Welcome to the Untethered Truth, discovering your best path to transplant. My name is Risa Simon, and like many of you listening to this program, I'm a kidney patient who for years was seeking insights to a better tomorrow. For years I was frightened and confused, and I felt like I was lost in a sea of hopelessness. I wasn't getting the answers from my doctor's office, nor was I getting any encouragement, so I decided to explore beyond those sacred exam room walls, and I discovered some unspoken truths and opportunities. And I was deeply troubled by what I discovered, excited that there were other opportunities, but troubled as a patient, confused why, as a patient, I had not been told this information. I was duped into believing that transplant and dialysis were equal. It was just a matter of preference. And so I dug even deeper to learn more, to do more, and I became so determined to fight for my best life possible, and that's exactly what I did. I became my own best advocate, and then I also started advocating for other patients and for patient rights. I was coaching patients and mentoring patients and being mentored at the same time. I continued my speaking career and published books on this very topic. And I reached my goal of achieving a preemptive transplant, and again, before I required dialysis, from a non-related living kidney donor. And I am so grateful to be living the life that I now live. I pledged to drop breadcrumbs along the way to fellow warriors just like you, just like those of you who are listening here today. And I became the founder and CEO of the Transplant First Academy and the developer of this program. And it is my hope by the end of this program, that you'll be able to identify barriers to transplant, especially preemptive transplants, getting a transplant before you require dialysis. It is also my hope that you'll be able to stand up, use your voice, refuse the status quo, and seek a better and longer life. It is my hope that you'll be able to use what you learn to educate others, even the general public, about the wait, the number of people waiting, how long the wait is for a kidney from a deceased organ donor, and the need for living kidney donors, the number of people that die while waiting for deceased donors. And it is my hope that you will strive to thrive, to live a better and longer life, the life I now live. It is my hope that you become transplant strong from this program and from what follows after this program. And I'm going to start this program by pulling the curtain back on unknown facts and conversation voids and poor timing to patient engagement. And we'll start with some facts. Transplantation is the optimal treatment for end-stage kidney disease. If you are transplant eligible, or you believe you may be transplant eligible, transplant is the path you want to seek. And even if you're not sure if you're transplant eligible, you still want to seek that path to see. Let the transplant center be the gatekeeper. And we also know, fact number 2, that preemptive transplants performed before the need for dialysis, offer improved graft and patient survival than transplants performed after dialysis. There are so many benefits of transplant over dialysis, much of what I did not know until I explored beyond those sacred exam room walls. Starting with less fatigue, depression, and pain, more freedom to travel, more freedom to secure your job, enjoy the foods that you love, very, very few restrictions on foods and fluids, and you can live longer. Let's look at just a basic graph here to your left, where if you look at 5 years out on dialysis, the survival rate is about 35%. 5 years out on a transplant is over 97%. And there's also reduced costs. The government can't even balk at this, because there's over $200,000 savings when we look at 5 years of one patient on dialysis versus 5 years of one patient on transplant. So transplant does equal better quality of life, better quality and longer life for those who are transplant eligible. And yet, after sharing those benefits and those differences, Preemptive transplantation is severely underutilized. Let's look at the numbers. Total kidney transplants to date of recording this program, 5/31/2019. So the end of May, as of UNOS opt-in recording, there are 455,000 kidney transplants that have been performed to date. Over 300,000, roughly 300,000 were from deceased kidney donors, and about 154,000 from living kidney donors. And yet of those 455,000 transplants, less than 3%, less than 13,000 of those transplants were performed preemptively, performed before the patient needed dialysis. And so we have to ask the question, why? Why are so many patients losing out on this opportunity to bypass dialysis like I was able to do? To bypass dialysis and to secure a transplant and to secure better outcomes. And the answer is because over 75% of patients are inadequately educated about transplant. And they're not encouraged to seek a transplant before dialysis. And there's also a nephrology practice mismatch between PKT, meaning preemptive kidney transplant value, and the timing of discussions and referrals. I'll say that again. The timing of discussions and referrals. There's a mismatch there in terms of the value of proactively encouraging people to get involved. The problem is that discussions are delayed because kidney function in many clinician and physicians' eyes appears stable despite those numbers being severely diminished, despite your GFR being severely diminished, despite the fact that you have renal insufficiency and your kidneys can no longer sufficiently function on their own. There appears to be some stability in those numbers, and so discussions are delayed, or encouragement or referrals to transplant may be delayed. And the risk here is that kidney function may decline suddenly due to underlying disease or an acute infection or other illnesses. Even if the labs are saying, well, it's sort of bouncing up and down, you want to proactively engage in a plan for your best and longest life. And when I talk to and hear from physicians, oftentimes they say, oh, I don't want to prematurely scare my patient. And you know what I say, and many others say? Nonsense. And here's a news flash for you. We're already scared, and information is power. But in the physician's defense, there is not sufficient time. There's a lot of stress in those dialogues. Patient may not even be wanting to have those dialogues. I know I have been there. If we roll back the tape to earlier years, I wanted my rose-colored glasses on. And there can also be a situation that is often referred to as compassion fatigue, when you're seeing patient after patient after patient with all the problems that the patients are presenting. Nephrologists and patients must agree that kidney failure is likely to occur. That really needs to be the top point. And then to commit to engage patients in proactive discussions to encourage transplant before stage 4, before the shoe drops. Preemptive transplantation is unachievable without early patient education, without timely encouragement, without timely referrals to a nephrologist from a primary doc, and also without timely referrals to a transplant center. And when I say timely referrals, I'm encouraging the discussion to begin at eGFR, estimated GFR 29 to 25, and the referrals to follow. We have to stop kicking the can down the road, whether it's you kicking the can, you as the patient, or the clinical team. Patient barriers. Here we have and hold some responsibility here. Could it be your fear and anxiety or medical overwhelm that's holding you back from fighting for your best life possible? Is it your inability to accept your diagnosis and prognosis? I know that's a tough one for many of us. Perhaps it's social, cultural factors, and plain old just being uninformed. Of course, if you haven't been encouraged or you feel that you have landed in a bucket of depression, and incidentally, my friends, you're not alone. Depression, the percentage of depression in patients with ESRD is 35 to 50%. That is a big number, but if you're not being encouraged, it's going to lead to deeper depression. I know it was for me. It led to my anxiety. And so we've been going about this the wrong way. If you're already on dialysis, it's not your fault. If you're approaching dialysis, it's not your fault because we've been going about this the wrong way. But it is now your responsibility to do something. When you have 98,000 individuals waiting for a deceased donor's kidney, and living kidney donors can provide us an express lane to get ahead, to actually take ourselves off the list. And when we take ourselves off the list with a living kidney donor, we actually allow those that are still on the list to move forward. We're actually giving them an advantage by taking ourselves off the list. So let's take a look. Let's average that number out to 100,000 people waiting for a kidney from a deceased donor. And if we look at how many people get their transplants every year, about 18,000 people get a transplant every year in the United States. So your number goes down to 82,000, right? There's 82,000 people waiting. Well, eventually, if there's always 18,000 people getting a transplant, eventually your name's going to make it to the top of the list, right? Not so fast, because every year about 35,000 new names are added to the list. 35,000 new names. So now we're back up to 117,000. And so supply cannot meet the demand. The average wait is 5. It could be as short as 3 in some regions, and it could be as long as 9+ in some regions. And so the bottom line here is to seek a living kidney donor. If you're hoping to secure a transplant before dialysis, or you're on dialysis and you're hoping to get off dialysis and live a better and longer life, time is not on our side, and we need to start seeking living kidney donors, increasing awareness. And another news flash here, breaking news, finding a living kidney donor is not a ruby slipper sort of thing. You can't click your heels together and hope that a fairy godmother is going to grant you this wish. It can come as an unexpected good fortune, but like most, it can be a painstaking process with false starts and broken dreams. And we need to prepare for that timeline. We need to prepare for individuals that may step forward and be disqualified, individuals that may step forward and may not even be able to make it through to testing. There are 5 stages of kidney disease, and our broken patient education system begins at stage 4. Here is the problem. Herein lies the problem. Medicare only pays for CKD, chronic kidney disease, education after a patient reaches stage 4 or beyond. So you can only bill education after they reach stage 4. So we must find incentives to motivate patients to be asking for more information early on, like this program, and incentivize clinicians as well. Some of you might say, well, that's ridiculous, but no, let's get back into the real world. Here's some suggested incentives to fairly compensate nephrologists for their time sitting knee to knee, eye to eye with you, talking about, hey, George, you could shoot for a better outcome here. You may want to get involved early on because this process takes time. We could add a separate payment code so those discussions could occur, yet of course we need to have the time to have that dialogue. And even if it's in a separate format, a workshop or a group educational format, that can be done. We want to incentivize transplant referrals so there's less pushback. So many patients and fellow kidney patients that I mentor and coach and that I speak to at seminars and that I hear from, book fans and whatnot, who approach me and say, my gosh, I learned so much from your program. I read your book. I learned so much and went back to my doctor and I said, I want to shoot for a transplant. I want to avoid dialysis. I'm ready to get my evaluation. And they were given what we call pushback. No, it's too early. not time to send you over there, and yet they were below 20 GFR. But your numbers look stable, and we'll just keep an eye on them. So we need to incentivize those referrals so patients can get over to that transplant center preemptively, proactively engaged, even if they're just having a conversation with a transplant center. And we need to offer patients no-cost workshops and patient guidebooks. So the incentives for the offices to provide the workshops and the guidebooks is to be able to provide those at no out-of-pocket cost for them, no overhead cost for them. And so this would make a lot of sense for engaging patients earlier. So we need to disrupt the status quo. It's time to go beyond the Hippocratic Oath, which has always been to do no harm, by starting to do more good. Never has so little been done by so many to benefit so few. This is a famous British wartime speech, but it seems to apply here, because we are just allowing patients like myself to sleepwalk our way to dialysis. Fortunately, I got a wake-up call. Fortunately, I went beyond the conversations in those exam rooms. I explored out, like many of you are doing right now listening to this program, so that you can empower your process. But there are some challenges to overcome. The pushback, as I mentioned, and difficulty navigating the transplant system of how to make that call and engage and get your evaluation scheduled, and how to send potential donors over to your transplant center. And then, of course, once you have sent potential donors over to the transplant center is prohibited from communicating to you about those potential donors. And so that's a huge challenge to overcome too. You really want to keep those conversations tight with anybody who is leaning in your direction and saying, I think I might be able or might be interested in seeing if I possibly could be healthy enough to donate a kidney to you, or if I might be a match. And then you want to encourage that individual, because the transplant center can't communicate directly with you, to stay in direct conversation with you, because it's kind of awkward for you to be constantly checking on them. And so we also look at the unexpected delays, the delays in calling potential donors back, scheduling not only donor testing, but also your own testing for evaluation, and the delays in committees reviewing your case. There is also something called a cooling off period. This is where a transplant center intentionally doesn't call back the potential donors, because they want to make sure that those potential donors that called into the center were serious about their decision to donate and help you, and they're not just going to fall off because of lack of communication. There's also confusion from the kidney allocation system. There's confusion because patients incorrectly interpret that they get credit for time on dialysis, so they think, oh, I get on dialysis first and I get waiting time credit. And that is confusing. You get waiting time the minute you're listed for a transplant. You do not have to go back to get onto dialysis. And yes, those that are in dialysis will get credit for their time on dialysis, but you surely don't need to suffer any time on dialysis to gain credit. You try to keep yourself as healthy as possible and maintain your eligibility for a transplant. So here's the proactive path to preemptive transplantation. You get referred and you get evaluated. Proactively engage with your doctor so that referral and evaluation process can get scheduled before you're in the danger zone. I personally was evaluated at 25 GFR. You will find there are a number of transplant centers that'll say, oh, too early, or nephrologists that say, oh, too early to even send you there. But I ask you to be diligent and keep working the conversation. And if you get a door closed in one direction, look for another open door. Do not give up. And then you need to start sharing your story. No matter what you've been doing before, I want you to ramp it up. Share your story. You're going to share your story to become a donor magnet. You attract potential living kidney donors, and you're not just doing it for yourself, you're doing it for all those in need. And you're going to build an outreach team. You're going to look to friends and family and gather these individuals to help you share your story, and ignite social media and have cards and signs. We'll talk a little bit about that in more detail in just a moment. And you want to schedule your strategic plan. Let me give you an example of a social media blog or communication calendar. Week 1, week 2, 3, 4, and 5, starting with posting an overview of your situation and your hope to avoid dialysis and find a donor. Week 2, you've got some more factual content on the number of people waiting, the life-threatening wait. Week 3, posting facts about living kidney donor transplant benefits, the testing process, maybe even the risks involved, and information about your transplant center. And then week 4, posting updates on your progress. Share your positive mindset and gratitude. Week 5, you're going to spend the remaining days, if there are 5 weeks in that month, to plan the next month. Let me give you an example of some posts. Week 1, dear family and friends. While some of you may know that I have kidney disease, you may not know that I've reached a point in time where my kidneys can no longer function adequately on their own. My hope is to get a kidney transplant from a living donor and avoid the 3 to 9 years waiting on dialysis for a kidney from a deceased organ donor. I'm sharing this update with you in hopes of finding potential donors who might be willing to test to see if we're a match. And if you're compelled to repost this message or help me share my story, please do. I'm certain my ideal donor is out there, and with your help, we're sure to find them. And then give them an opportunity to link and learn. Give them a link that takes them to your transplant center and other credible websites where they can learn more. Week 2. Hello everyone, I'm posting this update about my transplant journey to keep you all in the loop. Last week I met my transplant team at, and then insert the name of your center and the city and the state so people know where that is. And I also had a chance to talk to transplant recipients and donors about the abundantly wonderful life they now live. I was excited to learn that transplanted kidneys from living donors function better, last longer, respond more favorably than kidneys from deceased organ donors. I'm all for better tomorrows, and not just for myself, but for the 98,000 kidney patients across the nation in need. If you'd like to learn more or join my team of social media spokespersons, just say the word. I know my ideal donor is out there, and with your help, we're sure to find them. Again, another link to some credible sites, PDF documents, infographics, whatever you want to link them to help them learn more. Perhaps even your own website. Hello everyone, thought I'd post another update. I'm learning so much more about living kidney donor transplants, and I thought it would be a great idea to share some of that information. While it comes as no surprise that most people don't realize that they may be healthy enough to donate a kidney to someone in need while they're still living, they're most likely unaware of what that involves. There's lots to learn about the process, so for those of you helping me share my story, here's some quick sound bites everyone should know. Information and links on testing, surgery, risks, recovery, the matching process, paired donation, so they don't have to be your exact blood type, for example, and again, additional links where they can learn more. Week 4. Hello, my friends. I'm posting a bittersweet update on my search for a living kidney donor. I was informed yesterday afternoon that a wonderful friend who had been testing on my behalf was unable to proceed. The sweet part of this disappointing news is that I was filled with gratitude just knowing that someone I barely knew was willing to see if they were a match. Their heartfelt intention refueled my engine, and I'm now even more determined to share my story with as many people as I can. I want to help all those in need find their ideal donors, and I know they're out there, and with your help, we're all sure to find them. Thank you for caring, for sharing, and for reposting this message. Again, additional options to link to more information. So who's going to be sharing all this information? Who's going to be getting all these posts? Let's look at your outreach advocates, friends, neighbors, personal services. And what I mean by that is if you go to a barber or hairstylist, your nail tech, your dentist, your podiatrist, whoever, whatever offices you're in, whatever services you receive, there are people that work in those offices and they're always asking you, how are you? And a great opportunity to tell them how you're doing. Sorority, fraternities, school reunions, friends of friends, distant relatives, places of worship, great place to find individuals that may lean in your direction. Old pals, That's one of the beauties of being on Facebook, and even talking to your boss and coworkers. And of course, your family. You're going to start with your family. It's the easiest place for you to start, family and best friends. But you're never really asking. You're educating. That'll take a huge weight off of your shoulders. Here's some outreach materials. You want to build heart of mind capital. So to the left, I'm showing you a story contact card. On the far left is the front of the card. It's like a business card, you could say. It's got your picture on it, ideally. It's your name, your contact information, also information to your transplant center. And on the back of the card, it is a synopsis of your situation. I'm a kidney patient in urgent need of a kidney transplant. The number of people waiting, what your hope is to find a living kidney donor, to bypass dialysis, to end your wait. And if they'd like to learn more, to please contact you and or your transplant center. Or if you have an advocate that is working on your behalf, communicating on your behalf, they can contact them as well. And then you also see a sign with Michelle Fulcher, I'm a living kidney donor, and a link to a website that we created, onekidney.org. This was our billboard campaign down in downtown Phoenix, and we ran this for just about a year. Donate a kidney, save a life. We had real life living kidney donors on these billboards, and it drummed up some great conversations and some great interest, and I am so pleased to report to you that we've been tracking results, not specific from the billboard per se, because all that information is confidential at the center, but we can tell you that since we've run the billboard campaign and since we have so much more information, not only in social media and all the groups and organizations that are increasing awareness, individuals like yourself who are advocates for kidney patient rights and increasing awareness in the need for living kidney donation. In the state of Arizona, we have increased living kidney donor transplants by 32% since the time of posting of these billboard campaigns. So we're so delighted to be a small part of that success. And maybe you have signs on your cards, or you're just using a donate awareness, donate life license plate. Of course, you also want to create the verbiage and the content for these letters that are going out, and we have published examples of those letters in our Pursuit of a Better Life, the ultimate guide for finding living kidney donors. So we'll talk to you a little bit about that before we close our program, kind of Finding Donors 101. And we're not just talking about a book here. Yes, the book title is In Pursuit of a Better Life, the ultimate guide for finding living kidney donors. It is an editor's pick. It is paperback, Kindle, digital, and Audible. But what it really is a guide for individuals like yourself to become what we call donor magnets. You're never asking someone to give you a kidney. That is too big of an ask. It is an overwhelming ask, and it's an overwhelming ask for the person asking and the person receiving that content, receiving that request. It is far better to share your story, and we give you examples in there, messaging ideas, wording, layouts, as I said, example letters, example posts, outreach strategies, and guidance and encouragement to become a donor magnet. It is so important that you're sharing your story, and that's really, my friends, what I did for 18 months before I was fortunate to find my ideal donor. And that's when I found Mac. And on the left side of the screen in the purple sweater, I am now celebrating my 9+ years kidneyversary of Mac. Mac is Melissa's amazing kidney. In the purple sweater, you see Melissa, who is my living hero. We share custody of her kidneys, and I named the kidney that she gifted me. And the name of her kidney is Mac, M-A-K, for Melissa's amazing kidney. And we send each other texts whenever I get my lab results. I send Melissa a text with my creatinine and my GFR, and her response is, "Go, Mac, go!" And of course, the text is sent not just from Melissa, it's sent from MOAC, which is an acronym for Melissa's other amazing kidney. And it has been an incredible journey, my friends, and I know that if this is something that I can achieve, you can achieve this too. Now, it took me, Melissa was my unexpected 6th. It took me 6 potential donors I guess I should say 5 potential donors to find my angel sixth. And it took over 18 months of extremely proactive and engaged outreach to find my ideal donor. And this is why I'm encouraging you to start early, to start now, and it's never too late. Well, for some of you, you may have missed the timeline to have a preemptive transplant, but boy, the less time on dialysis, the better the outcome. The more you can improve that trajectory. And we hope that speaking of trajectories, we hope that this program, this webinar, the Untethered Truth, where you can discover your best path to transplant, is going to become your new North Star to a preemptive transplant. Your North Star to bypassing dialysis if I caught you in time. And the opportunity to secure the quality of life that you deserve. Now is the time to do that. The Untethered Truth is now in your hands. You have the information to overcome those barriers, to bypass dialysis, to receive a transplant, and to live your best and longest life. You've got this. Thanks for joining us for the Untethered Truth. We hope to hear your success stories soon.